Indeed, the global update. Let's move over to Toronto in Canada, where a consultant radiologist and chief executive officer of ProRad Health Centers, Dr. Tayo Denton, joins us to look at the COVID-19 situation in that country and what, if any, lessons Nigeria can learn from the country's response efforts. Good evening, Dr. Denton. Thank you so much for joining us.
Good evening. Thank you for having me.
Now, you have been in self-isolation for almost 2 weeks yourself after returning from a trip outside Canada. How strict are the isolation guidelines in Canada and how are they enforced?
Well, there's actually legislation behind it. I came back from Nigeria, and there is legislation which basically says that any traveler coming into Canada has to self-isolate for 2 days. And that's what is otherwise detained. So when it is military as a means country of flattening the curve, which is ensure there are not many cases overwhelm our cases.
Now, I do apologize. We seem to be having some problems with the audio of this Skype from Toronto. Now, Dr. Denton, if you can still hear me, and we hope that this gets better for this question. We also talk about the home delivery system, the health delivery system, that is. What is government doing to cushion the effects of some of the gaps in that system, given what is going on now?
Well, things like border closures and social. So most of the country is actually on lockdown. For essential services, most people are staying at home and they're keeping to that stay at home. I would, however, notice that it is something that we are able to do as a so-called first world country. The other thing is obviously sanitizing, hand hygiene, and testing. But testing it's a more liberal testing that I understand goes on in some places, but you still need symptomatic patients. You still need to have symptoms, healthcare workers, people in hospital, or recent travelers.
Now, if you're to take a look at it, I'm sure, as you said, you come back from Nigeria. The big news that came out of Canada with respect to this was that the Prime Minister's wife had contacted COVID and had gone to the UK and had been back and so on. But at the base level, what is it like? We're hearing of shortages in the UK and in the US. Is it the same or is it very different in Canada?
Right now, I'm in contact with my colleagues in the hospital who don't have shortages. We seem to be faring better than our neighbors. So we have protocols. People are keeping to those protocols. And it's whatever we have is being used. We're still aware that worse is still to come, that it's going to get worse, but we still are we have the same problems as US, UK, Italy, etc.
Finally, Dr. Denton, what would you advise? I mean, you've been here in Nigeria and you're back in Canada. Now, what would you advise, given your experience, that we should do more in this, in respect of our own efforts in Nigeria to tackle COVID-19?
I think it's important not to feel that we have to export what Canada is doing wholesale into Nigeria and realize that we need a solution which is not only effective, it's humane. And part of it was to make sure that travelers come in actually get tracked and tested by whichever means. Now we have able to track by cell phones or maybe your credit cards. But testing is an important thing, and maybe to decentralize that testing. My understanding is the testing is entirely by the NCDC, and maybe it's to decentralize it a bit more so that more people can get tested. Because the only way is not just by having those people who contact NCDC, is to be able to have people who go into the usual hospitals and clinics to have testing available to them without having to go through the process of maybe going to a website. How many people have computers that they can actually go and notify NCDC that and the symptoms are not just fever, cough, and difficulty breathing. There are also other symptoms which people need to be aware of so that we can catch this early. I think for us, it is catching it early enough that it doesn't become a tragedy.
Now, sorry, I said I had asked the last question, but I wanted you to expatiate a little on some of those other symptoms, because for most people, they've only heard of the three that you mentioned.
Yes, there are actually a wide range of symptoms. You have GI symptoms, you have diarrhea, you can also have loss of taste and smell, very important ones. And there are all kinds of other things that are coming up that are associated with COVID so we have to expand our net of people who are symptomatic and not just insist on all three. And there are people who will come in not necessarily with a fever, not necessarily with a cough or with difficulty breathing, but they will have, and I have had colleagues who have had experience of this, where they came in with just diarrhea, and it turned out they were COVID.
All right, thank you very much, Dr. Denton. It's been a pleasure having you with us. Dr. Tayo Denton is a consultant radiologist and chief executive of ProRad Health Centers. As you've heard, she herself is in isolation in Toronto, Canada. She joined us via Skype. Thank you very much. And we'll take a break at this point. We'll be back with our closing moments.